They won't tell you this at your regular doctor's visit, but men are dying, younger, weaker, and more broken, not because of disease, but because of something preventable. Every year, thousands of men unknowingly cut off their body's most natural survival tool by giving up masturbation in later life. And the cost is devastating. Fading erections, collapsing hormones, shrinking vitality. It's not about sex, it's about survival. And if you think this doesn't apply to you, think again. I'm a urologist and men's health specialist with over 30 years of experience working with aging patients across the country. I've sat with farmers, veterans, teachers, and grandfathers who all thought they were doing the right thing by abstaining. And I've watched the quiet regret in their eyes when the damage finally caught up. Because most of them had no idea that the habits they picked up decades ago, habits society told them were shameful, are now silently backfiring in the most critical years of their life. But there's good news. In this video, I'm going to walk you through the 4 real health consequences that occur when you stop masturbating in older age, and more importantly, how to prevent them before it's too late. These are simple, practical, medically sound solutions that thousands of my patients have used to protect their sexual health, restore their energy, and avoid common issues that most men mistake as just getting old. And make sure you stay until the end, because the last consequence I'll share is the one even most doctors won't talk about. Yet it's also the one that could silently triple your risk of prostate complications if left unaddressed. If you care about protecting your body, your confidence, and your independence as you age, you'll want to hear it. And if you're watching right now, type 1 in the comments if you're with me, or 0 if you're skeptical. I welcome both, because this is a conversation older men deserve to have, without shame and with real answers. Now let's begin with the first and perhaps most dangerously overlooked consequence of giving up masturbation in old age. I've seen it more times than I can count. A man in his late 60s or early 70s walks into my office confused and frustrated. He tells me he hasn't had a spontaneous erection in months. Sometimes it's been over a year. And what shakes him the most isn't the lack of performance, it's the suddenness of it all. One day he felt like himself, the next something inside just stopped working. It catches most men off guard. Why? Because no one ever told them that giving up sexual activity could cause their sexual function to fade away like an unused muscle. Let me put this plainly. Your penis is not just an ornament, it's a functional organ that requires regular circulation to stay healthy. When you go long stretches without any stimulation, especially after age 60, something dangerous begins to happen. Blood flow slows down, oxygen delivery decreases, the tissues begin to stiffen. Not in the good way, but in the way that leads to fibrosis, nerve damage, and irreversible loss of erectile capacity. That's not just theory, that's basic vascular biology. Think of it like this. If you stopped moving your legs entirely for 6 months, what would happen? You'd lose muscle, coordination, flexibility. You might even forget how to walk. The same principle applies to the penis. After a certain age, it doesn't just go on standby, it starts shutting down when not used. And the worst part? This decline doesn't come with a loud warning. It's silent, creeping. You don't notice until it's too late. One day you realize your morning erections are gone. Then even physical touch or fantasy doesn't do the trick. Eventually, even with medication, the body doesn't respond the way it used to because the foundation has already eroded. I've had men sit across from me, eyes watering, asking if they can get it back. Some do with aggressive therapy, lifestyle changes, and medical support. But others? They waited too long. They thought quitting masturbation was harmless, that it was a sign of self-control. But in reality, it was the quiet beginning of functional decay. And let me be clear, this isn't about being obsessed with sex. It's about protecting a vital part of your circulatory system, your hormone regulation, and your masculine identity. Maintaining occasional solo activity, even once or twice a week, can keep the blood flowing, keep the nerves alive, and remind your body that this function still matters. The truth is, what you don't use, you start to lose. And when you're older, that loss can be permanent. I've seen it devastate men. not because they're trying to impress anyone, but because it impacts their self-esteem, their relationships, their sense of being a man. And what's most tragic? It was preventable, completely preventable. All it required was consistency, not indulgence, but attention. But here's where it gets even more surprising,
losing their erections,
because what starts in the prostate doesn't stay there.
Just the beginning.
The next consequence affects not just your body, but your
masturbation
brain.
Affects something
and once
even
it begins,
deeper,
it can alter
your
the way you
hormones.
think,
And
feel,
once they
and
begin to
remember,
crash,
sometimes
the
in
ripple
ways that are
effects go
difficult to
far
reverse.
beyond the bedroom.
Let's talk
Let
about
me show
what
you
happens to your
exactly how
mental
it usually
clarity and
starts.
cognition
Subtly,
when self-stimulation
a man stops
disappears
feeling
from
like
your
himself.
routine.
But he
If you're
can't
still
quite
here and
explain
these
why.
insights are resonating
He's
with
not
you,
as excited
type
to
the
get out
number
of bed in the
1 in the
morning.
comments.
He skips
It
his
lets me
walks.
know you're still
His
with me,
appetite
still
changes.
engaged,
His
and
mood
still
gets
valuing
flatter.
this message.
He feels more
Now
tired
let's
during the
continue
day,
with point number
more
2.
irritable, more withdrawn.
Cognitive
And deep
fog
down,
and
he
reduced
senses
mental
something
clarity.
important is slipping away.
Not long ago, a
but he can't
patient
put
in
his
his
finger
late
on it.
60s came
In
to
my
see me.
clinic, I've
He
seen
wasn't
men
complaining
chalk it up
about
to
his
aging,
prostate or
to
his energy
stress,
levels.
to bad
He
sleep.
just said something
But
that
when we
struck
dig
me.
deeper,
Doc,
we often
I
find
don't
the
feel like
same
myself
root cause.
anymore. I
Their
walk into a
testosterone
room
has
and
dropped,
forget why I'm there.
Not just
I
naturally
lose
with
my train
age,
of thought
but
mid-sentence.
accelerated by the
I used to be
complete loss
so
of
sharp.
sexual
Is
stimulation.
this just old age?
And here's what most people
It's a question
never
I hear more often than you
Masturbation
think.
is one of the
and
few
yes,
non-pharmaceutical
aging naturally
ways
brings
older
some
men
cognitive
can stimulate
changes.
natural
But what most
testosterone
people,
production.
even highly
It's not about
educated,
sex or
health-conscious
fantasy.
adults
It's
don't
about
know
biology.
is that sexual
When you
activity,
engage in regular
including
arousal
masturbation,
and release,
plays a
your
powerful
brain sends
role in
signals that
protecting
help
brain
regulate
function.
your hormonal
Here's what
rhythm.
happens.
Dopamine
When you
levels
engage
rise,
in self-pleasure,
the
your
hypothalamus
brain releases
activates,
a
and your
cocktail of
testicles,
neurochemicals,
even in your 60s
dopamine,
or 70s,
serotonin,
get the
oxytocin,
message. Keep
all of which are
producing
directly
testosterone.
linked to memory,
But when you stop
focus,
that process
and emotional
altogether,
regulation.
when you go weeks
These
or
chemicals
months with
aren't
no
just about
sexual
feeling good
activity
in
at
the
all,
moment.
the
They
message
help
your body
build and
receives
protect
is the
neural
opposite.
connections.
It
They
thinks
stimulate
intimacy
blood
is no
flow to the
longer
brain.
needed.
They
So it
reduce
scales back
cortisol,
hormone
the stress
production.
hormone that
And
in
once
high
that
amounts
cycle begins,
actually
it
damages
can
brain
become
cells.
hard to reverse.
Now, when you
Men
stop
with low
masturbating,
testosterone
especially
don't just
over a
feel
long
tired.
period,
They
those
begin to
natural
lose their
brain
identity.
protective chemical
They can't
surges
focus.
become
They lose
less
interest
frequent.
in the things that once
Over
made them
time,
proud.
this can dull
Their
your
muscles
mental
begin
edge.
to weaken.
You may find
Their
it
bones
harder to
become more
concentrate,
fragile.
harder
They
to
become more
process
prone to
information,
depression,
or even
and perhaps
harder to
most
feel
dangerously
motivated.
of all, their
It doesn't happen
cardiovascular
overnight.
risk
It sneaks in
increases,
slowly.
putting them in
First,
greater
you forget
danger of
names.
heart attacks and
then
strokes.
you forget what day
I've
it is.
seen once vibrant
then
men
you start to
become
doubt your
shadows of
mind
themselves
entirely.
within a few short years.
And in that doubt,
not because they were
something
sick,
worse can
but
take
because
root.
no one ever
Fear.
told them how
I've
vital
seen patients
healthy,
spiral into
regular
anxiety
sexual
and
stimulation
depression
is simply
for because they
maintaining
believed
hormonal
they were
health. One
when
patient
in
of mine,
reality
a
their
retired
brain was
firefighter,
starved of
told me after his
stimulation
hormone
and chemical
levels dropped,
balance.
he began to
In
feel
men,
like
there's
he
an
didn't
added
matter
hormonal
anymore.
shift.
His words still sit
Testosterone,
with me.
the hormone
He said,
deeply tied
"Doc,
to
I don't
memory,
even recognize the
decisiveness,
man
and
in the
vitality,
mirror,
can
and I'll
decline
never forget
faster
the
when
look in his
sexual
eyes.
activity
It
drops
wasn't
to near
vanity,
zero.
It was grief.
Testosterone isn't
And this
just
didn't
about
have to
libido.
happen.
It's about
With
your
a little
sense
education
of self,
and
your
a simple
strength,
habit he
your
thought was
clarity,
wrong,
and
he could have preserved not just his
frequent,
hormones,
healthy
but his
ejaculation
happiness,
can
his
help
energy,
regulate
his
and
drive.
preserve
Because here's the
testosterone
hard
levels
truth.
as you age.
Once your testosterone
Some studies have
crashes
even
in old
begun
age,
linking
it can
reduced
take
sexual
years of
activity
therapy and
in older
thousands of
adults
dollars
to
to get
early
it back,
signs of cognitive
if it comes
decline,
back at all.
even dementia.
But with steady,
Now,
respectful
I'm not saying
engagement in
stopping
your own
masturbation
intimacy,
causes
you can
Alzheimer's,
hold the line
but I am
longer
saying
than
this:
most people think
when the
possible.
brain is deprived
And
of
while hormones are
stimulation,
often invisible,
emotional release,
the next
and
consequence
hormonal
is something
support,
every man
it becomes
feels
more
in a much
vulnerable.
more physical,
it loses its
sometimes
rhythm,
painful
its
way.
resilience,
A condition
and
that
for
builds
many people,
quietly
the
deep
fog
inside
becomes
the body
thick enough to
until it
change the
starts
way they
interfering
live,
with your daily
how
life.
they interact,
And most
how
don't
they
even
think,
realize it's
how
tied
they see
to
themselves.
one simple thing.
One
they're
man
no
told me he
longer
stopped
doing.
going to his
Let
chess
me
club
explain.
because he couldn't
There's
focus
a kind
on the
of
game
discomfort
anymore.
older men
Another,
don't
a
often
retired
talk
teacher,
about.
said
A
he
heavy,
felt
dull
blank
ache
every
deep in
morning.
the pelvis.
These
A
weren't
strange
memory
pressure
problems
after
that
sitting too
required
long,
medication.
or the nagging
They were
need to
symptoms of a
urinate
life
even when the
disconnected
bladder
from
isn't
physical
full.
intimacy.
It doesn't
even
come on
with
suddenly,
oneself.
like a heart attack.
And here's the
It
tragic
builds
part.
slowly.
These are
quietly,
avoidable
until it starts
You don't need
disrupting your
expensive
daily
pills
life.
or therapies.
And by the time
Sometimes
most men
it
mention
starts by
to their doctor,
reconnecting with your
they've already
body,
been living with
giving
it
it
for
the
months,
attention it
sometimes
quietly
years.
craves.
What's
Because when
shocking
you
is how
stimulate the
often
body,
this silent
you
suffering
awaken the brain.
can be traced back
But
to
this
one
loss of mental
overlooked
sharpness
cause,
is just one part of the
prostate
equation.
congestion
What happens
caused by a
next?
lack of
When
ejaculation.
emotional balance
Your
begins to
prostate
erode
isn't just a
and your mood
bystander in
starts
the male
slipping
body,
without warning,
it's an
can be
active
even
gland
more
that
subtle,
produces and
more
stores
damaging,
seminal fluid.
and much harder
That
to talk
fluid is
about.
meant to move.
Let's
It's
explore
meant
how
to be
giving up
flushed.
self-intimacy
When you stop
can
masturbating
silently
or having
invite
sex
depression
completely,
into your daily life.
especially in your later years, that fluid sits. And when it sits, it thickens. Pressure builds. Inflammation creeps in. That's when you start noticing changes. Slower urine flow, discomfort in your lower back, that constant need to go feeling that wakes you up in the middle of the night. As a urologist, I can't tell you how many older patients come in thinking they have a bladder issue, only to discover that what they're dealing with is an irritated, inflamed prostate. In many cases, the solution isn't medication, it's movement. It's the body's natural cleansing process through regular ejaculation. And when that process is ignored for too long, the consequences can be severe. Some men develop chronic prostatitis, a painful, long-term inflammation that's difficult to treat and even harder to live with. Others find themselves needing invasive procedures just to feel normal again. And beyond the physical discomfort, there's another layer of danger that most men never hear about. Research, including a well-known Harvard study, has shown that regular ejaculation may help lower the risk of prostate cancer. The theory is simple. When the prostate is regularly emptied, it reduces the buildup of potentially harmful substances. But when that fluid is allowed to stagnate for months on end, it may increase inflammation and long-term risk. One man I treated had gone almost 2 years without any sexual activity. He didn't feel the need, he told me, thought it was behind him. But when his PSA levels spiked and we ran more tests, we found significant congestion. His prostate was swollen and irritated, and he was facing biopsy discussions that could have been avoided with something as simple and natural as maintaining occasional release. This isn't about encouraging lust or indulgence. It's about preventing suffering. It's about understanding that the male body doesn't suddenly stop needing care after 60. If anything, it needs more attention, more respect. The prostate is one of the most vulnerable organs in older men, and when neglected, the damage isn't just uncomfortable, it can be life-altering.
The final consequence hits deeper. It strikes at the core of how a man feels about himself. And for many, it's the one they never see coming until it's already taken hold. Let me show you what I mean. It's the quietest decline of all, and often the most devastating. It doesn't show up on blood tests, it's not something you can easily measure, but you feel it deep down. A slow fading of the spark you once had. A creeping sense of disconnection. A distance from yourself that you can't quite explain. It happens gradually. You stop masturbating because you think you don't need to anymore. You tell yourself it's age or a lack of interest, or simply the way life works when you're not in a relationship. But over time, that decision doesn't just affect your body. It reaches into your mind, your emotions, your very sense of being alive. I've spoken with men who've said they feel hollow inside, not because of disease or pain, but because they've gone months, sometimes years, without any form of release, without any intimacy, even with themselves. And slowly, they begin to feel invisible, unwanted, unnecessary. They don't talk about it, of course. Most older men were never taught how. But it shows in the way they walk, in the way they avoid mirrors, in the way their voices grow quieter when you ask how they're doing. This isn't about sex. This is about vitality, about the subtle but powerful connection between your physical body and your emotional well-being. When you give up self-pleasure entirely, you cut off one of the last remaining pathways to joy, to self-recognition, to feeling human. And for men over 60, that's not just a loss, that's a wound. Because arousal, pleasure, and release aren't just for youth. They're part of what keeps your brain engaged, your hormones balanced, your emotions healthy. Neurologically, the chemicals released during masturbation, dopamine, oxytocin, endorphins, are essential for regulating mood, reducing anxiety, and reinforcing emotional stability. Without them, men are more likely to experience depression, loneliness, and even cognitive decline. I've seen men who were once confident and sociable slowly become isolated, withdrawn, and apathetic. Not because their lives changed drastically, but because they stopped connecting with a part of themselves that once made them feel alive. And here's what makes this so dangerous. Many men don't realize this connection exists. They never link the emotional numbness to the decision they made months ago to stop engaging in intimacy. By the time they feel the effects, the damage has already begun, and reversing it requires more than just hormone therapy or a new routine. It takes rebuilding the relationship with yourself, remembering that even in old age, your body still longs to feel, to express, to connect. This is the consequence that breaks my heart the most, because it's the one that steals a man's dignity without him even realizing it. It takes away the quiet confidence he used to carry, the warmth he used to offer, and leaves behind a shell he no longer recognizes. But here's the truth I want every man to hear. It's never too late to come back to yourself. Never too late to reawaken the energy you thought was gone. And in the final part of this video, I'll show you exactly how. The simple science-backed steps you can take today to restore what so many older men have lost and what you still have the power to protect. Let's finish this together. There's a belief many older men carry that intimacy, pleasure, and desire are things you grow out of. That after a certain age, your body is supposed to go quiet. That it's noble, maybe even respectable, to give that part of yourself up. But after more than 30 years as a doctor working with men in their 60s, 70s, and beyond, I can tell you that belief is costing far too many men their health, their happiness, and their identity. You've heard today how stopping masturbation can lead to the slow breakdown of your sexual function, a dangerous drop in your hormones, the swelling and inflammation of your prostate, and a silent emotional numbness that erodes your spirit day by day. These aren't small changes. These are life-altering shifts that happen not because of aging, but because of neglect. But the good news is that it doesn't have to be this way. Your body still remembers how to feel, your mind still longs for connection, and your health still depends on you honoring every part of yourself, even the parts no one else sees. This isn't about lust, it's about life. It's about preserving what makes you feel strong, whole, and human. You don't need to feel ashamed for choosing health over silence. If this message resonated with you, I invite you to take it seriously. Take it personally, because it is personal. And if you're ready to take back control of this part of your life, I'm with you. You're not alone, and you're not done yet. If this message spoke to something inside you, even just a little, type 1 in the comments to let me know you're still here, that you still care, that you're still fighting for your health. And if it didn't, that's okay too. Type 0 and tell me what you need. Either way, your voice matters, and you're not alone.